Hello, my name is RaShae Robinson, and I'm the lead pre-transplant coordinator at UAB. I would like to thank you for choosing UAB for your liver transplant needs. The information you need to know in this video, we will go over what is EUNOS, what is a Mel Score, how do I get on the wait list, what happens while I'm on the wait list, and what happens when I'm called in for transplant. UNOS is the United Network for Organ Sharing, and they are a nonprofit organization that manages the National Transplant List. All patients that are listed for transplant are listed on UNOS, and they have great information at eunos.org, or if you have questions, you can call the toll-free number. What is a MELD score? MELD stands for Model for End-Stage Liver Disease. It is a system used by UNOS in order to ensure that the sickest patients are the ones that are receiving organs. As your MELD score is higher, then you will be higher on the transplant list. Scores range from 6 to 40, with the largest numbers assigned to the sickest patients. We get your MELD score by taking several of your labs. So the total bilirubin, which is your liver function, creatinine, which is your kidney function, sodium, and INR, which is your clotting time. We put those into the system and get your MELD score from 6 to 40. If you happen to get labs done at your local doctor, you can always go to eunos.org and click the link for the MELD calculator in order to calculate that yourself if you want to. This table shows the frequency of getting your labs updated once you're on the transplant list. As you see, the 25 or higher has to be updated every 7 days, and then we have to have those labs in the system within 48 hours. The 19 to 24 MELD scores have to be updated every 30 days, and those must be in the system within a week. So as you see, your score gets lower, the time is farther out for the updates. If your labs are not certified by that date, your score will drop down to a 6. So if you remember, just go ahead and get your labs done as soon as you can and have those sent to us. That way we can get you updated on the list. These are the tests that we will do during your evaluation. We will do labs, which include HIV, drug screen, nicotine screen, and alcohol screens. We will also do abdominal imaging, some heart tests, which will include an echocardiogram and either a stress test or a heart cath, and that's going to be determined by your previous health history. We will do an EKG and a breathing test, which is a pulmonary function test. You will also have consults with social work, the financial counselor, a pharmacy, dietary, the coordinator consult, and you'll have appointments with the surgeon and the hepatologist. Questions answered by the evaluation. Of course, we want to make sure that the risk of transplant are less than those living with the liver disease. So we want to make sure that your heart, lungs, and kidneys can handle the surgery and also the medications afterwards. We want to make sure that you and your family can cope with the stresses of the surgery, the pre and post transplant aspects of coming to clinic and doing those things. How well do you participate in your own health care? And then also the social work and financial counselor will go over the cost of surgery, the monthly medication expenses, and also lodging coming back and forth to clinic. The risk and benefits of the evaluation. So the risk, you may have an allergic reaction to the contrast dye or a small amount of exposure to radiation from the scans. You may also have a new diagnosis of a previously unknown medical problem. The benefits, of course, are you'll have the increased knowledge and understanding of your medical condition. You also have the possibility of being placed on the transplant list. So just know that it is always your choice to be on the transplant list, even if we think that you're an acceptable candidate. So planning financially for your transplant, the social work and financial coordinators will go over your insurance deductibles, prescription copays. You also, need to think about if you have to go to rehab afterwards, travel expenses, food and lodging, and of course, child and pet care. So our liver disease conference, or we call it LDC, is held every week, and we discuss every patient's case individually. You will get a decision letter within 7 to 10 business days from that, and the decision will either be listed, not listed, or deferred. And deferred just means that we need additional testing or additional appointments, and our office will get those scheduled for you. Not listed patients. So the reasons that you may not be listed. So if you are early for transplant, which just means that your liver is not sick enough for transplant at this time. If we have psychosocial concerns, so just say if someone does not have a caregiver to help them through the process, that would be an example of that. Not being abstinent from illegal drugs, alcohol, or tobacco. So just depending on which one of those is positive, will determine the follow up from that. If you have a medical condition that puts you at an increased risk for the transplant surgery, then we need to take care of those things first. So, for instance, if we find that you might have a blockage, if we do a heart cath, then we need to get that blockage taken care of before you go for your transplant surgery. Other reasons would be morbid obesity, tumor outside of EUNOS criteria, or cancer outside the liver. And then the process for getting on the wait list, of course, you have to complete the evaluation process. Our transplant team will review everybody's case individually at our weekly LDC meeting. Then if we accept you as a candidate, then we have to get approval by the insurance company. You will be placed on the transplant list, and from there, then we will send a letter notification to you, the patient, and also to your referring physician. So things to do while you're on the wait list. Make sure and pack your bag so that you're ready to come to the hospital. Make sure and have, medication list, phone list, people that you need to call packed in there and ready to go. Make arrangements for childcare, pet care, home care. So just kind of think through your process of what you would have to do if you got a phone call at 2 a.m. What are the things you need to check off and make sure are done before you can walk out the door. Make a travel plan because we don't provide transportation. So I would suggest have a couple of plans, have some alternate plans because the first one may not work out, and that's not something that you want to be trying to think of at the last minute. Keep your cell phone on and charged when you're away from home so that we can get in touch with you. And arrange for your support person who will help you after transplant. And you might want to have one or two of those also if possible. Communication while on the wait list. So make sure and update your coordinator with any changes or additions to your contact information. If you happen to be hospitalized locally, make sure and let us know that because that may be something that we may need to have you transferred to UAB. If you have any serious illnesses or complications, make sure and let us know that too, even if it's just some lab work because we might can update your score on the transplant list. Notify your coordinator with any changes, insurance changes or cancellations. That's definitely something we do not want to wait and find out at the time of transplant. So let us know as soon as you find out of any potential changes. Also, communicate with your insurance case manager to verify all of your covered benefits. And of course, let us know if you become pregnant. So follow up while you're on the wait list. You still need to follow up with your primary care physician. They are going to be the ones to still manage all of your other health issues. So your, high blood pressure, they'll be managing your blood pressure medication, your insulin for diabetes. So make sure and continue to follow up with them. You will have periodic checkups at UAB, and that will be determined, at your visit of when you need to follow up. And that's just based on, how sick you are, if you need to follow up at 1 month, 3 months, 6 months, etc. And also your annual screenings are important. So make sure and have your dental clearance, prostate exam for men, and pap smears and mammograms for women. And if we need to have any abdominal imaging or lab work done, just make sure and keep up with that also. So you can be listed at multiple centers at the same time. If you're listed with us and you want to be listed at a different facility, then just go through their evaluation process and then you can be on their wait list, and that may shorten your time, your wait time on the list. Also, you can transfer your waiting time. So if you have to move out of our area and you want to be listed at another facility, just go through their evaluation process, get on their transplant list, and then let us know, and we can transfer the time that you've accumulated at UAB over to that center. And that way you don't lose any of your time. So what happens when you're called in for the transplant? You have 6 hours to get to UAB. So just make sure and have your travel plan in line. You should have a map that came in your evaluation packet. So if you just look over that and kind of get an idea of what's where, that would be great. Please let us know when we call you for transplant if you've recently had any illnesses or fevers, because that will determine, the path of care for you at that point. Do not eat or drink anything once we call you, unless the coordinator specifically tells you that you can. Okay. We may know that the transplant may not happen till the next afternoon, so that would be an example. But do not eat or drink anything unless we specifically tell you that you can. Your family members will need to make hotel arrangements for the first 1 to 2 nights because you will be in the ICU. Okay. What do I need to bring with me? So make sure and bring your insurance card, prescription card, eyeglasses, hearing aids. If you have a glucometer, family member, of course, or your caregiver, medications, list of medications, and then money for any copays, food, things that you would want to do while you're at UAB. Our team members are our transplant surgeons, our hepatologists, our nurse practitioners, inpatient and outpatient nurse practitioners, pre-transplant coordinators, post-transplant coordinators, the transplant assistants, social workers, the financial coordinator, and the pharmacist. And these are our important phone numbers. If you have any questions, please do not hesitate to give us a call. We want to help you in any way that we can. And once again, we want to thank you for choosing UAB for your liver transplant needs.